Cancer Buzz is here in Austin, Texas this week for ACCC's 40th National Oncology Conference. Right now, we're here with Debbie Rimmele. She's a nurse retention specialist at Loyola Medicine in Chicago. Debbie, a big focus of discussions and learning this week is around strengthening the oncology workforce, which is, of course, the theme of ACCC President Dr. Ajayi's term. You're leading a discussion today called Recruiting Strategies Looking Under the Hood of the Employment Process. Why is it so important to examine your recruitment process?
I think that recruiting is now a little bit different than it's been in the past. I think we used to always just put a job post out, the applications would come flooding in. But it's different now. I think the whole recruiting process is changed, and we've got to really find a way to change along with it.
What are potential employees looking for now?
I wish I knew that answer. I think that's the big buzzword for today. I think employees are looking for managers that they can connect with, a manager that they can actually see themselves working with. That's a different thing right now because there's a lot of ways that we have to connect with our managers. So in that interviewing process, they're looking for a manager that's sincere, that they can connect with. I think they're looking for a team that they can actually fit in with, a culture that actually promotes them to learn. But I think most importantly, our recruits are looking for that work-life balance, that wellness within the organization. And I think that's a lot of what has changed.
What are some quick tactics to consider when you're trying to really showcase your cancer center?
I think for me, I always like to have a few buzzwords that I like to use. If it's Monday through Friday, if we have set schedules, I like to talk a little bit about why my job might be important for them to look at. I also like to talk a little bit about some of the professional growth opportunities that we have in our cancer center. So come to our cancer center and look about all the different things that you can do. What's going to happen in your first year, but what's going to happen at year 2? What's going to happen at year 3, 5, 10? So I like to talk a lot about all of that in my interview process.
Thank you, Debbie. Cancer Buzz will be back again later today to share more from the ACCC 40th Annual National Oncology Conference. Until then, this is Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.